Hey, everybody. Class 12, Friday night. Nowhere else I would rather you be than with me on this Friday night, talking about the important topic of the baby and learning a new coping technique of massage. So I'm so glad that you're here. If you're watching this in the replay, I love to see the hashtag replay comments below the video. Please let me know where you're watching it from or anything about what you're watching. Hashtag replay. Hello to everyone watching live as well. Mental Health Mom, how fun. I love that you are here. I actually talked about you in class, I think yesterday. Yeah, it was yesterday. That is so cool. Mental Health Mom was so gracious to allow me to do a birth reaction video. And her beautiful birth, where she just did excellent, so many coping techniques, and it was amazing. Really great birth video vlog. And Mental Health Mom, I used your example of how I love in your video where you stopped and did your hair before you left. Because I was telling people that if that makes you feel good, do it. So, hello, welcome. So cool, so cool. Okay, hello to everybody. I see some Minnesotans in the chat. You guys are talking about that. Hello to Ashley, Kiana, to Brandon, to Natalie. Hello to Kyle. Hello to Jonathan, Killian, Day Naklu, I think. Hello back to Dabu Doodles. I was going to check on you guys because you weren't here last night. You have such a good, memorable name. So it's like, we miss you when you're gone. Hello to everybody. I love so many people. Hello, Rachel E. and Catherine have been here night after night, live or in the replay too. And it really shows that you guys are dedicated to preparing for this big day, which high five to all of you. It's so important to get, I think, to get that education, but also just give yourself that time. Give yourself that time to actually sit and think about this big day, get some takeaways, and you're dedicating to this important time of your life. So cool. Oh no, third trimester hitting hard. I know what you mean. Whoa, that third trimester can just zap your energy. Absolutely. Today is a great time for you guys to get into the chat, to ask questions, to, you guys who have been here before, if it's your first time, the chat is a great place for you to answer my questions. Let me know if I'm on track. And answer your questions. And I'll try to get to as many questions as I can. So, Kiana's getting induced tomorrow. Okay. That's exciting. Very exciting. So we're going to send some major positive labor vibes to you tomorrow. That is very, very big. So hopefully we got that induction class in just in time. I was thinking this morning about, Mental Health Mom. Hello, you're here now. You had to get through the ads. Welcome. I was thinking about our chat member, Graceful One, I think was her YouTube handle, who joined us in labor yesterday. So maybe we'll get an update today or maybe tomorrow or something. I don't know. Okay, let's jump in. If you guys are following along in the book, page 25 is a little bit on page 25, but I wanted to show you, we're going to talk also about page 60 a little bit or some. This whole blue section of the book, if you guys have the book, you can flip to the back. This whole section here is about life with baby. And I know I mentioned it before, but it has it's such a quick go-to guide. And I know when I had I had this giant newborn book and it was so overwhelming. So anyway, if you have the book, it's a great guide. And if we're on class 12, it doesn't matter. I think the book is still worth it, and it's still $19 while we're doing our class. The book, the handouts, the fan. So I know you guys are pros here. You've been here for many days. And so you probably could tell people about what I'm talking about with the book and the kit. Great. Okay, Anna, you're going to let us know how it goes. Good. And mental health mom, if you didn't hear my spiel, you have to check yesterday. I was talking about you and how you were very inspiring to us and letting us use your video. Okay, so yesterday we talked about cesarean birth. Hopefully that feels a little better, have some coping techniques, have a little bit of an idea of that emergency versus non-emergency, planned, unplanned, and reasons, that type of thing. But before that, when last we left, we were pushing. You guys remember that? Oh, pushing. I think it took place right over there. And I went into a little detail about supporting the perineum and a little bit about episiotomy, tearing, and forceps and vacuum. But I feel like I kind of rushed through that, so I'm going to start kind of there. We're going to talk about the baby coming out, skin to skin, placenta, anything like repairs and that kind of thing afterwards. And then just sort of the first hour, 2 hours of what it's like with the new baby. So I'm really excited to jump into this. Oh yes, Kiana's question. How many days are you doing this class? Yes, so I'm doing 14 days and today we're day 12. So we have day 13 tomorrow on Saturday night, and Saturday night we're talking about postpartum preparation. And I think I mentioned it the other day, but I'm also doing kind of like a catch-all because there are a few topics that I didn't cover that are kind of a quick cover, like IV narcotics, IV pain medication, nitrous oxide, a few other pain management things I wanted to mention. So, and then thank you, Kiana, for this question, because I put on March 14th on Sunday that we're going to do a quiz. And if anyone's ever done a Kahoot, we're going to do a Kahoot. Last time I did it on YouTube, and there was a weird, the delay made it difficult. So it's my project this weekend that I'm either going to add time, which I think that's what I'm going to do, so we can still do a Kahoot. Kahoots are so fun. If you haven't done them, it's a great quiz. We'll see what we're going to get right, what our takeaways are. So I'm going to work on this weekend. If you were in the December class and you experienced the Kahoot quiz and the delay, I'm going to work on it so it's better this time. And I said that we would have a special guest. I'm not entirely sure. I'm going to look at timing, and I don't want to skip out any content. So we will see. Great question. And then, so Sunday will be the last live class, and then the classes will be available for replay through the end of March. Awesome. Okay. So when last we left the baby was pushing. We talked about Ring of Fire. I mentioned a little bit about episiotomy and how it's really only done for fetal distress, though I always suggest that people talk to their providers about how often they do episiotomy and for what reason, so you have an idea what to expect. Providers will often support your perineum, like put their hands right there as the baby is crowning, and that can help avoid tearing. And we talked about warm washcloths at that time as well. So one thing I did not mention about pushing for partners that I want to throw out there, that if you are someone who very much does not want to see anything below, you don't want to see the baby coming out, maybe for whatever reason, totally your choice, just let them know and just make it a statement like, I'm going to be up here, this is where she needs me, and then just stop. Sometimes I see labor and delivery nurses like really trying to get partner to, watch what's going on. And if you don't want to, you don't have to. Okay. Just a little tip I thought the other day that I did not include in this class. But if you do want to be active, or even you want to help guide the baby out and catch, talk to your provider about that too, because that can be really awesome. So the flip side of that is also something that can be done. Okay. So what happens? Baby comes out, right? Baby is born. What research tells us is that the best thing to happen now, two things. First of all, the cord, there's a lot of research lately into something called delayed cord clamping and cutting. So, I have a slide, not like yesterday. I actually have slides about this. And this is a topic that you guys have probably heard about, that you might have even researched yourself, but I want to show you some language that was taken straight from the American College of OBGYNs that says in term infants, so infants that have made it past that 36 weeks, delayed umbilical cord clamping increases hemoglobin levels at birth and improves iron stores in the first several months of life, which may have favorable effect on developmental outcomes. So what they're saying here is that a delayed cord clamping could actually help your baby with this iron store and help them with their developmental, milestones that they're going to hit, crawling, sitting, all of those milestones along the way. So it's huge. I didn't include it on here, but for premature, so before term infants, it's even more significant of the benefits of delay. So the research is very clear. The American College of OBGYNs supports this. And then also on the American College of OBGYNs website, they say, given the benefits to most newborns and concordant with other professional organizations, so that would be like the midwives, American Academy of Midwives and the maternal fetal specialists. So all of these organizations, they have agreed with American College of OBGYNs now recommending a delay in umbilical cord clamping in a vigorous term and premature infant for at least 30 to 60 seconds. Okay, so let me know in the chat. After hearing this, after hearing that it can be beneficial for hemoglobin, so the red blood cells for our baby, beneficial for their iron stores for baby, and that the actual governing body, recommending body of the OBGYNs has said should be 30 to 60 seconds at least, okay? Then here's my question for you guys. Do you think that it is done, has practice changed? Are doctors and midwives, are they all waiting to delay the cord? Let me know in the chat if you think that it's like, of course everybody's doing it because this is very clear, or if it's not. Meanwhile, what I want to do is you can keep commenting in the chat. I want to play this 30-second clip again that I think I used at least once for our practice breathing, just so you can feel what 30 seconds is, okay? So baby comes out and then start the 30 seconds. Yeah. Okay. So it's not short, but it's not super long, right? That 30 seconds. So I see some chat. Sounds like a lot of people have already started thinking about it. I love that. That's great. What I want to share with you is that even though it's so clear, I showed it to you on the screen. And below the video, I have a link to that page on their website, just so you guys can look at it too. Yes, welcome O'Neill, and yes, not long at all. So many providers still, baby comes out, about 10 seconds later, they will cut the cord or clamp it. And once you clamp the cord with they have these clamps, that metal like scissors clamps that go down, it's already, it might as well be cut. There's no like unclamping and letting the blood still flow. So let me answer some of these questions, which you guys have some great questions. So Killian, it depends on who you ask. So there are many people like home birth midwives and midwives that think that advocate for like a 3 to 5 minute delay, but the American College of OBGYNs didn't quite go there yet with their recommendation. You certainly have the right and the preference that you can say you want to wait until the cord stops pulsating. So the cord, if you feel it when the baby's born, it will feel almost like that heartbeat, like pumping, right? And after a few minutes, and it's usually a few minutes, you will see or feel that the cord has stopped pulsating. So it does take a few minutes before that happens. Oh, Dabu Doodles has asked that exact question. Yes. So really, doulas and childbirth educators would love to see that be recommended by the American College of OBGYNs, that it's longer, but I'm absolutely appreciative that they made this statement of 30 to 60. And the reason that the statement is so powerful is because now if your provider says something like, yeah, we don't do that because it's going to increase jaundice, or it's going to, or here's one that I've seen recently on a birth vlog, that baby was born and the doctor, so imagine I'm the doctor catching baby, right? Person that gave birth is here, legs, baby comes out, doctor is just holding the baby. Parents are here, doctor's holding baby, because there was this old thought that you had to hold the baby down, like from the placenta for the blood to get to the right place. I cannot believe that this is actually still happening in 2020. It was in 2020. I'm not sure about 2021. So we have really clear evidence that we can advocate for ourselves and say, we want this. Ashley said, oh, great. Ashley said, already discussed cord clamping with the provider, as well as no bath until we are about to be discharged. So I love this. And as far as bath, we are going to talk about the bath too. We're going to talk about the bath. Oh, good. The provider said, now here's a little trick. So your provider, Ashley, says she's going to wait until it stops pulsating, which I love. That's amazing. A little, not trick. I want to say it's a hack, whatever you want to say. I love when partners get involved and say, because it's easier for them, they haven't just given birth, and say, can I touch the cord before you clamp it? I'm really curious. I learned all about pulsating. Can I see what that feels like? I'd love to feel the difference before and after. And I'd love to be involved in that. And it's pretty clear. I mean, the cord comes out, when the baby comes out, it is no joke, like this thick. And then if you would allow the cord to have like an hour, like at a home birth or something, I'm looking for my straw. I can't find it. You guys know my straw. It's like a clear, flat straw. It blows your mind. It's so cool. Good question, Kyle. What does vigorous mean? So vigorous means that the baby is breathing well, looks healthy right at the start, like does not have low muscle tone, floppy arms, like, and when baby doesn't have low muscle tone, when baby has a low muscle tone, they're not holding their arms rigid. They're kind of just floppy. And a vigorous baby is like possibly crying, moving, good muscle tone, good color, which thankfully is how the majority of babies come out, that they are vigorous. So that's a great question. If the baby is not vigorous, means that baby is born with a low APGAR. So baby is, which I'm going to talk about APGAR some more, but it's that quick number to let that people know, the doctor, the provider, the midwife knows that how baby is doing. So it's color, respiratory rate, fetal heart rate, muscle tone. So they look at all of that real quick and they give the baby a score. If baby is concerning, like they need to do some more extra suctioning, they need to give baby oxygen, whatever it is, then there is no delay. They need to immediately cut the cord. They don't even let partner cut the cord. They cut the cord and get the baby over to the care team that's going to take care of the baby. Okay, so partners can be super interested. And I love this super interested partner technique also for the placenta. Okay, so let's talk about the placenta a little bit. First of all, and also just so you know, and I'm gonna do skin to skin again. But when baby comes out and is looking good, and we do skin to skin, which again, I'm gonna talk about that. The cord is still going to be on. The placenta is going to still be inside your uterus. Okay, that's very normal. If there was any kind of injury to the tissue, a tear, an episiotomy, all of that is going to happen after the placenta comes out. Okay, baby, you're going to wait there for me for a second. We got to talk about this placenta. The placenta, through a series of hormones that happen after the baby is born, the placenta separates from the uterus. It usually kind of drops down kind of to the top of the cervix. And if you are unmedicated or you have a very light epidural, you might start feeling like you need to push again. And I've even had many times clients that will be like holding their baby. They're like, oh my gosh, I just had a baby. This is crazy. And like 5 minutes later, they're like, I kind of feel like I've got to push again. That is the placenta. That's the placenta ready to come out. In an ideal world, the placenta is allowed to come out on its own. So the placenta detaches from the uterus, kind of comes down into the cervix, and then the person that gave birth can do a small push. Sometimes providers will say, give me a big cough, and that's enough to kind of get the placenta sort of down. Birthing the placenta, and we call it birthing, which is interesting. You birth the baby, then you birth the placenta, is so much easier. No bones in here. Very easy, almost like a non-issue for as far as pain and that kind of thing. But it's not a non-issue in that it's very important that the placenta comes out successfully and in all pieces. Both the placenta needs to come out together, all pieces, and the sac, the membranes, the amniotic sac, we want all of that to come out. Now, the reason that we need to make sure everything comes out and detaches is that if any piece of placenta is left inside your uterus or attached to the uterus, that placenta gives off hormones telling your body that you're still pregnant and can greatly interfere with breastfeeding. So it's a huge, huge issue that we have to make sure placenta comes out well. Which, you guys, I'm going to get to your questions. You've got great questions coming up on the chat. I love it. So what we don't want to see is pulling or pushing on the uterus and pulling on the cord and kind of forcing the placenta to separate and come out. And I hate to also be the bearer of bad news in this, but it happens all the time. And I went like this because like it really makes me crazy. Like it really makes me crazy. So I also recommend a very curious partner. Doulas also are great at this by saying, is the placenta already ready? I know we didn't want to force it out. I even had a partner say, we had a friend, or my sister had a retained placenta, and we really don't want that. So I know you want to look at your baby partners after baby is born, but we really need you to stay in the game until the placenta is out, at least, through that time, to make sure that you're advocating and watching. Really, a little bit of traction a little bit of pulling, that's okay. Vigorous tugging, and I've seen tugging, and it really just takes a question. I have said it before where I'll say like, oh, is the placenta already ready? Or, are you feeling an urge to push, like to my client? And that sometimes providers are like, oh, that's right. It's weird. I don't know why that's still done, but it can be dangerous. Okay. The other thing about the placenta is if you want to ensure, kind of like a double check, that it looks that all of it is out and that there aren't any membranes, you can always ask them to show you the placenta. Or if you're curious, like, I mean, granted, this is my job, and so I think placentas are just absolutely like mind-blowingly cool. I can understand why people wouldn't want to see them, believe me. But if you are curious, make sure you say, hey, don't leave until, can I see the placenta? And either the nurse or the care provider will like show you, this is what it looks like, this is the membranes and whatever. And it gives them just another chance to check it out. Can you guys imagine that scenario? Natalie, let me get some of these questions in. Do you recommend saving cord or placenta for stem cells? So a couple things. What most educators give this answer. So this isn't like my personal answer. This is just that if you have a history of cancers, blood cancers in your family, then I would research it. Or if you are not Caucasian, I would research it and think about it because there's been such a big donation program, which is excellent. There is quite an overload, I think, not overload, but there's a lot more options out there, but not in non-Caucasian, like double Caucasian parents. I've heard like that is the most. So that meaning that if you didn't store it and then you needed it, how likely are you going to find a match? Let me know if that makes sense. If your hospital accepts donations, then you do need to make the choice on your own. Would you rather have the delayed clamping, or do you want to donate? So usually if you're going to donate, they need to clamp on the earlier side so they can get a good donation. And that's totally personal preference. So I hope I answered that okay. Marginal cord insertion affect the placenta delivery. So marginal insertion should not affect it at all. I mean, we still don't want them. I guess maybe there should be more. No, I don't think so. I was thinking, Brandon, that would it matter as far as traction? Not really. Marginal cord is not uncommon. So that's when the cord is not, for those of you who aren't familiar with that term, doesn't attach right in the center. If it's kind of on the side, then no, I wouldn't think that has any difference, but that's a good question. And Kayla about Pitocin. Yeah, I'm going to answer that. And let me see, O'Neill. Yeah, I definitely would ask your provider, but do a little bit of research. And I'm going to actually ask, I would say that, yes, it's a better idea, but I'm going to see if I can find a good article for you. But yeah, that it might be something to consider. Might be. But I'm gonna research that. Okay, Kayla's asking about Pitocin after the birth, which is funny enough. If you could see my notes, it is the next thing I'm talking about. So a lot of hospitals will give postpartum Pitocin postpartum to help the uterus clamp down. Now, it's not given until after the placenta is actually out, because we don't want to trap the placenta inside the uterus. So it's actually after the placenta comes out, that's when the postpartum Pitocin is given. So what this means is that if you have an IV already, they will hang a bag of Pitocin and you will get a full, usually, bag of Pitocin. Now, you won't be feeling it. Even if you are unmedicated, you might be feeling a little crampy if you're unmedicated, but you don't feel a lot. So it's one of these things that postpartum hemorrhage is serious. So it's a serious complication after the birth, though it's more rare. It can happen. It's not super rare, but it's not super common. It happens. And so what medical practice has decided is that if we just give everybody Pitocin, then we're going to catch a lot of those possible postpartum hemorrhages. But clearly, a lot of people are going to get Pitocin that really didn't need it. So I know you asked, what are your thoughts on Pitocin to get placenta out, which is really not to get the placenta out, but to get the uterus to clamp down and postpartum hemorrhaging. I mean, I would love to see providers wait and see and ask for informed consent and have that be a shared decision-making moment. But it's not often unless you ask for it. The other thing about it is that while it's given via IV commonly and routinely, there is an option to get it intramuscularly, so in a shot, like in your thigh. And I have had clients that didn't have an IV, like they had a natural childbirth, and natural meaning unmedicated childbirth, and they didn't want to get an IV started. I mean, they had a port, but not anything flowing. They did not really want that. And so they asked if they could do the IM version of it instead, which is, just as a side note, is funny. I have had doctors say, like, to my clients, like, are you sure you want to get it? Because it's a shot in the thigh. And it's like, well, but I just gave birth vaginally, so I think I can handle that. I'm pretty sure I'm cool. I'm pretty sure I can handle a shot in the thigh after this 8-pound baby just came out of my vagina. Hello? What? That was always really funny. Yes. Yay, mental health mom. Attaching baby to breast immediately can help so much. Yes. So we're going to talk about those early cues and breastfeeding, but all of this, the body is really set up in a pretty amazing way to work. Doesn't always work, right? That's why we have hospitals and providers and everything, but it often does. So it's the postpartum Pitocin is definitely a decision point that you can always talk to your provider about. That's a great question, Kayla. Thank you for bringing that up. The repairs, if you have a tear, an episiotomy, after the placenta comes out, at that time, your provider will usually do the repair. If you did not have an epidural, they will give you medicine to numb it, a lidocaine usually locally. So on your perineum, where the tear is, they will numb that area before they do any kind of repair, any kind of stitches. I always, sometimes people, I mean, it's a pain in the butt because you want to hold your baby, you want to start breastfeeding, you're feeling a little bit like you can do all this while they're doing the repair. It's a little awkward, but it's okay. I have sometimes seen nurses say, oh, don't worry about breastfeeding until after you get a repair. And it's like, it might help you for some distraction if you just allow your baby to, try to latch on. So you want them to take their time. And so I wouldn't, try to rush them. Not that you are, but sometimes if it seems like it's taking a long time, that's actually a good thing because we want them to take their time. Let's see. What is next? Pitocin after birth practice looks like the vitamin K shot to a newborn. Yeah, it's kind of a similar idea of like a catch-all, just in case. Does endometriosis, this is a question I might not know the answer to. You might have stumped the childbirth educator, Kyle. Does endometriosis have greater risks of hemorrhaging and therefore is it better to get Pitocin post-placenta? I don't know. Oh, Mental Health Mom has at least a 1 off. She says she's never had Pitocin. Okay, yeah. I've never heard that question or that together, but I don't want to say no because I don't know exactly. So I'm going to check on that too. I'm making a little note. Okay, now is a great time to talk about skin to skin and time with the baby. This is a big deal for me. And if any of you guys have been doing the homework, you might have looked into where I've been putting the homework or following how I've been setting up the homework, and you probably didn't find it because I forgot to set up the homework for today, which is okay because it gives me the opportunity to allow you guys to watch some clips with me together. So I'm going to share my screen like I did the other day, and we are going to do watch a video. The good news, because yesterday was kind of, it didn't work very well with the sound. I think that was yesterday. You don't really need the sound here. Okay. So just disregard the sound. I am going to show you a few clips of the first few moments of baby. So I want you to look at them and see, like, skin to skin. Are we seeing skin to skin? What is happening when the baby comes out? What does everything look like? And I'm going to meet you guys, or we're going to talk about it after we show these clips. So let me make myself small. Here is our first clip. Baby has just been born. Okay. In the chat, was that a good example of skin to skin? What do we think? Was that a good example? I loved, it was so beautiful. I mean, she was so happy, and it was such a great, great picture, right? No, you're right. Dabadoo, everybody's like, no, 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 no. I cannot tell you. I can't even tell you how many times this happens. I know I've told you many times about how I watch these 100 birth videos, which is where I met Mental Health Mom's video. I watched 100 of them and I was taking notes. I'm working on a video. I just don't know what it's about. I was taking notes like, no skin to skin, no skin to skin, no skin to skin. And it was time and time again. I have seen it. And it's so weird. Skin to skin is so critical for babies. And it means naked baby on naked parent, skin to skin. It does not mean just this part of the baby. And it does not mean just like your hands. It means like full baby on your skin. When we do this, babies start regulating everything. Their breath, their respirations regulate, their heartbeat regulates, their temperature regulates, and their blood sugar regulates. Their blood sugar regulates just by you holding them skin to skin. It is so research-based. They have signs all over the hospital, skin to skin, how important it is. And then we see this happening. We do. We still see it happening in 2020. I'm sure in 2021. So let me show you. I've got to move over here for a second while I get to the part in the video and show you another example. Okay, good. Right here. Let me make this bigger. Okay. So take a look at that. So can you guys see how that her gown is like totally up? It's just scrunched up, right? And then baby is on right low, kind of low, probably because of the umbilical cord. We're going to see one more. 6. So look at that baby, how it looks gooey, right? We've got up, it's up here. Oh, an ad. We don't need that. So what do we think? Did you guys see how different that is between what we saw and the first, with all of the blankets and everything covering, wiping, and the second when it was basically just up here, everything pulled up, scrunched, and she's holding. That's a big difference, right? That is a huge difference. So partners, here I am putting it on you again, just because you're going to be available to watch. You're going to be available to check this out. And it's so important right before we think baby's going to be born, in those pushing moments, to prep. Like if you have on a bra, I suggest taking the bra off. And I think I mentioned that before. I feel strongly about taking the bra off before a baby's born. If you're wearing a gown that has the snaps down the sides, unsnap your gown, right? If you're wearing a t-shirt or your own thing, have it ready to take off, pull it up, have a plan for how you are going to help make skin to skin happen. If your nurse, your doctor, your midwife, whoever holds the baby up, wipes off, you know what partners can do? Can just reach over and be like, she's ready for the baby. Like show, like, hey, she's ready for the baby. Like skin to skin. Oh no. And you know what? The other thing you can do is take the blankets off your baby. If baby came to you, if for some reason they did a blanket or something in that beginning, take it off, move it, get that skin to skin. Yeah. Why do they clean baby right away like crazy? It's just an old practice. That's how it used to be done. Does baby need to be skin to skin during cord pulsating or directly after? So we want baby skin to skin as soon as possible. So hopefully during that whole cord pulsating time, absolutely, like out of our vagina onto our chest, as long as baby is looking healthy, and they'll know right here. Now, one exception is with meconium. So if baby, not exception, after, like if baby wasn't looking healthy, if baby is looking healthy, but there was a thick meconium, so if baby had their first bowel movement inside our uterus and the fluid was really thick, like a thick green, then sometimes they will do a quick wipe of baby's face. Sometimes they will cut the cord quickly and then bring the baby over to the warmer, do some suctioning, and then get baby back. But that can be an exception for that. Skin to skin, Natalie, should last for at least the first hour. Have you guys ever heard of the golden hour? So that initial skin to skin ideally lasts for a whole hour. But here's what's so awesome about skin to skin is that it doesn't need to only be right when the baby's born. There have been benefits shown that when babies are held skin to skin for weeks after birth, that it helps form their brain, that there's a lot of synapses in the brain that are created, that there is still benefit to skin when you get home. And there is benefit not just to the birthing person, but the support person with the baby. So if for some reason, like C-section, a complication, something like that, support person, partner, take off your shirt, skin to skin. Okay. It's so important for baby to be skin to skin in those first hours. Yeah. Mental health mom, you are making this, and I love that you've had 2 children. You're making an excellent point. Let me bring up my slide because I think I need to show a slide right now. Let's see. This is my slide, not this one. I'm getting it. Here it is. It is your baby. This is hard for some people, and I understand it because it's like this, you know, the baby's in there, and you know that everything you're doing affects baby, and you're taking care of this baby and whatever. And you love the baby already. But sometimes once the baby's out and you're like, sometimes people are not trusting of themselves. They've never had a newborn before. The first time you do it, you've never had it. So sometimes it can feel a little like, that doesn't feel right. I'm not sure if I want that. I want you to know that you have options with this baby. You can, if baby comes back to you from a warmer, wrapped in a burrito towel, unwrap it, put baby here, cover it up. If you're doing something that's harmful, you will be told. Like the nurse will say, baby's getting cold, we need to whatever. But, and just like mental health moms saying, ask them not to clean the baby. Yes, this is your baby. You can delay the bath. This is not a medical reason. And using that acronym, that BRAINS acronym, benefits, risks, intuition, alternatives, not now, whatever, is something to use with baby too. Okay. Very, very important. I do not have permission to show some of the videos. I haven't received permission to show them in class, but there are some YouTube videos that are just, to me, painful to watch because you're seeing babies be taken for no reason during that golden hour for the reason like, oh, we want to weigh your baby. We got the scale. Do you want to see what your baby weighs? If it's in the first hour and you want to get your baby off to the best, healthiest start, say no. No, I don't want to see what my baby weighs. Can you delay those? Can you delay the measurements? Of course you can. Do you want to be, I saw a video where they took baby away during the first hour. I mean, it was clear it was the first hour to do the baby's footprints. Footprints aren't even necessary. So why would you, do that? But I know that new parents, we don't know. We don't know what's important. So what I want you to know is that babies are healthiest skin to skin for at least an hour, and ideally through breastfeeding for the first breastfeeding. So if anything is coming in the way of that, ask your questions and use that BRAINS acronym. Do we have to do this now? Do I have options about this? Because I'm pretty sure I learned in class how important that skin to skin is. I'm holding baby like it's my baby. It feels weird. Like, do I throw it around or do I treat it like a real baby? Okay. Did I get worked up about this? It's important. I hope I did. Anissa says, is there any long-term effect for C-section delivery where there's no skin to skin, even 2 hours? So, I mean, it's not ideal. It's not ideal. If you can get at least a partner in there holding skin to skin, that would be a preference that I would try to do. Sometimes we don't have choices. If baby's not doing well and we can't do skin to skin, we can't. We have to take what we can get. Ashley said, I'm asking my provider to allow for a minimum of 3 hours of skin to skin with me before doing any measurements. Love it. Love it, Ashley. Yes. And you know what, Ashley? That I almost feel like that, I mean, that's good that you're saying I'm asking my provider, but I almost want to use the word like I'm letting my provider know that I'm planning. I'm letting my provider know that I'm planning for delaying measurements and all of that for 3 hours. It has a little difference than asking, but you are the parent, so you have every ability to do that. So Natalie, there's new research out that delaying a baby's bath is actually better for getting breastfeeding started off right. So that they say that if you can delay it until after initial breastfeeding or even after a day, 2 days, that it actually can help with that breastfeeding. I'm sure it has to do with like skin to skin, the bacteria that is good bacteria that we want, that's on baby, that's on parent. So then that is why. So yeah, that's a good question. And I know some people are kind of like, ugh, doesn't my baby need to be bathed? But really, baby doesn't. Like, we can wipe off their mouth. We can wipe off their hands, which is really the only thing that's touching their mouths. I mean, they just came out of the womb. So, yeah. Oh, mental health mom. It looks like they did measurements right away in your video, but it was 2 to 3 hours later. Yay. That's so good. You know, the only time I can tell exactly is if there's like a continuous shot from birth through the measurements. So yeah, you don't actually really know. Yes. Right. In that video, she was still wearing her gown. Okay. So skin to skin, the other couple of things about our new baby is they are going to have they might be looking a little bit different than what we kind of picture a baby. You guys have probably heard about the cone head. Sometimes they might have gray hands. That's normal. They might have covered in vernix, which is like a white kind of cheesy type substance. They might be blotchy. They might have swollen eyes. They might have a puffy face, like puffy eyes, puffy face. There are some changes that happen in those first 48 hours to baby and baby's appearance that you'll be surprised about. So if you see your baby and you're like, wow, baby's been through a lot, just know that things start evening out. The head starts rounding out. Puffiness goes down. It's really pretty amazing when you look at pictures from, hours old to days old to a week, how so much change takes place. If you have your camera there, try to take a video or an audio of the first cry. This is like a little spare tidbit. This is not a must. I just think it's pretty cool. I try to do it as a doula. So, partners, you've got your phone out, baby comes out, turn on the video, get a first cry, get a picture, watch for the cord, try to make sure it's not pulsating, make sure we're not taking out the placenta. I know it's a lot, but you can handle it. The ideal latch we want to have within the first 40 minutes. Now that's a long time, but time can go by fast. We want to look for hunger cues. We talked a little bit about it yesterday, where baby rooting. So when baby's cheek is touched, they're almost like a baby bird looking for a worm. Like, where's that worm? That's the rooting. They might be doing tongue thrusting. Those are all signs that they are ready. I really recommend putting baby to breast and seeing what baby does. Like, often they will try to latch on their own, which is amazing. So in the first couple minutes, hold baby, get yourself together. Sometimes it's a lot like, what just happened? And then once you're like, okay, this is my baby. I did this. I just gave birth. Oh we have a baby. And then if you see some of those cues, you can see, but don't feel like cord is still pulsating. I've got to nurse my baby. So it doesn't have to be that fast. We can have a little bit of time to regroup and get ready. Breastfeeding is like a dance where two people are learning, right? Two people are learning. So it can take some time. This is certainly not a breastfeeding education course, though I do recommend taking one. And yes, but those are just my initial first things. So the thing about babies and their stomachs are very, very small when they're born. So they don't need a lot of food, and they don't really even need a lot in the first 24 hours. So we've got some time to get this dance going, but working on the first latch within the first 40 minutes is ideal. Yeah. Ashley says, I've heard sometimes when pain relief or epidural are used, baby can be sleepy and hard to get initial latch. Yeah, it can. That can happen. Sometimes we have sleepier babies with a long epidural. It's not, I think I mentioned with our epidural class, it's not research-based. Like, we don't have clear evidence. Like, I didn't make a slide out of it. Anecdotally, we hear about it a lot, and I've certainly seen it a lot. And that's more, I personally have seen it more with an extended epidural, 12 hours, 15, 20 hours. But sometimes that's the tool that we have to use or we choose to use, and we gotta do what we gotta do. So, yes. So here we are, babies. What else? There is often a rush of adrenaline after you give birth. Like you get that birthing high. It is generally higher if you are unmedicated, but everybody does experience it. Though sometimes we see partners experience a relief, and it's almost like they were trying to be so good or were being so good. And once baby is born, it's just like, oh gosh, now I can relax. Everybody's safe, which is a great time. Partners, just make sure you're taking care of yourself. Eating, drinking, snacking. I know I say it a lot. So many times I've worked with partners that put off eating and taking care of themselves, and then they crash. And we don't want that to happen. Yes. What else? I think that I am ready to talk about massage in our last 4 minutes. You guys have had some excellent questions. I hope that you're at a place that it makes sense, that I drilled into your heads the importance of skin to skin and make it happen. And everybody is going to get rid of their bra immediately because I said no bra. I mean, you don't even have to wear a bra in labor unless you feel more comfortable with a bra, but you can do whatever you want, wear whatever you want. It's up to you. You are in charge, and it's your baby. Now, we have been talking about our coping techniques. We are on day 12, and we have been talking about them every day. Wow. Yesterday, we talked about fear, tension, pain. I signed you a homework for counter pressure, which if you haven't watched it yet, make sure you watch it. Visualization, vocalization, hydrotherapy, breathing, limp and loose in labor. So many movement, right? Actually, I was at the grocery store today, and in Seattle, they sell alcohol at the grocery store, which is really weird to this person from Atlanta because in Georgia, that is a big no. They sell it at, its special liquor store. Anyway, I saw Captain Morgan when I was walking by. I just looked. I didn't have a basket. I was walking by and I looked. I was like, oh, childbirth class, Captain Morgan. So we've had so many good tools, right? I hope you're feeling like you have lots of options. Massage is another great option that can provide pain relief. It can provide help in relaxing the muscles. And just truthfully, can be a really good way for two people to connect in labor. So even if we don't really need pain relief, if you're feeling good, it still can be a real nice closeness. So some great places to do massage is our shoulders, our feet, and hands. Those are great touch points. Also, if we're having back labor, we can do massage on our back. So shoulders, hands, feet, and our back. Steady pressure is so much better than random. So I have a video that I was going to put in our homework, and I will share it with you guys. I will put together the homework, and I want to make sure that you watch it, about an easy massage technique that I call SOS massage, which is steady, one direction only, and slow. So I'm just gonna massage the baby real quick. So instead of doing I see this so much. Partners are just doing this random massage, which sometimes can feel really good, but an easy is just slow and steady, one direction. And, if you can think of petting a cat, right? It's like that. So you can do that on your shoulders. You can do that on someone's arm, right? You don't need to know special massage techniques to get benefit from this. And I'm gonna jump in and answer some of these questions. The biggest mistake You guys, I need to know in the chat, what is the biggest mistake when it comes to massage in labor? This is my I don't really have evidence on this, so it's not research-based. It's doula, been to a lot of births based, and talking to people. Drink your water. Let me know if you know what the biggest mistake when it comes to giving massage in labor. When is it recommended to give a bath? So it's really your preference. It's a delay. They recommend delaying it several hours. And then whatever is your preference. Some people like to get instruction from the nurse, like in the postpartum wing of the hospital. And that way you can do it together as a team. And they can show you like some tips and stuff like that. That can be helpful. But yeah, exactly, Ashley. It's a personal preference. But it is nice to learn. But make sure you let them know, like, hey, I'd love for you to do the bath day 2, before we are discharged, and I really want to watch. So both of us, like you and your partner, to watch. So make sure. Rachel, this is a good one. Stopping too quickly. I think that's my number 2. That's my number 2. Too much. My number 1 is a little bit tricky. Too much pressure. That's a good guess. Smiling. Not enough pressure. I love that. Correct pressure. Okay. No, Rachel, yours was actually good. What I see, number 1, it's not done. It's not done. Or people try it. They don't get a good, like partners try it. They might get like that doesn't feel good. And then they never try it again. That's my number 1. It's never tried. Number 2, it stopped too quickly. When someone's giving you a good massage, and you're just like, oh, it's feeling so good. And then they stop. You're like, oh, I wanted them to last longer. So remember this, partners. If you try massage and it's not helpful, or your partner is like, no, well, you might find that it works. It feels better later. Okay. So do not feel like, oh, I tried it, it's over, because labor is like 18 hours. So we might need to try it again. I also highly recommend that you practice this. This is a great, like, getting ready for birth activity. Why don't I give you a massage, right? Let's try out Alice's SOS technique, slow, one direction, steady. Okay. We are here at the end of class 12. I can hardly believe it. We have 2 more classes left. Thank you guys for spending an hour with me. So cool that we were able to hang out. Questions in the chat. You guys that have been in the chat, amazing. If you found any takeaways, please hit the like button. If you want to share it, that would be excellent. I forgot to show my birth affirmations today. My birth affirmation is, I am doing this. Great thing to tell yourself when you are in the thick of pregnancy, in the thick of any of these challenges that we have leading up to birth, during birth. I'm doing this. I'm doing it. You are in it. So great. Thank you guys so much for tonight. Thank you, O'Neill. Man, you are too cool. Thank you so much. Oh, Dabadoodle, smash the like button. My kids will be happy. I will tell them it was smashed. Thanks so much. If you guys, I forgot to mention that the group that has signed up so far for our decision-making workshop is a nice little group. I'm already so excited about it. I've already started working on getting some of the details together for that. It is the March 16th and it is March 29th. So that is what it looks like. And it's $49. So if you're interested in joining that, you still have time. And the other thing I wanted to mention is that my private consultations are on sale right now, $40 off. So they are at /private. So if you need some private consultations, that's available too. I have talked too long, but I will see you guys in the after the class if you're joining me there. And thanks so much. Thanks, guys. See you next time. See you Saturday. Have a great Saturday until we see each other again. Bye.